consultant radiologist from Al Bahira Hospital. He is an interventional radiologist. He will talk about tubular mapping for skin surgical flaps. Dr. Mostafa.
بسم الله الرحمن الرحيم. ارحب بالساده زملاء الدكاتره وارحب بالتشير بيرسونز الكرام اساتذتنا الكبار. اتشرف اعرفكم بنفسي دكتور مصطفى عبد الحميد، استشاري اشعه تشخيصيه وتداخليه محافظ البحيره في وزاره الصحه. Our talk today is about surgical flaps, tubular mapping for surgical flaps. Actually, it's a bridge between radiology and surgery concerning the plastic and vascular surgery specifically. First, dedicated for them. First, we'll talk about Doppler. Doppler is an ultrasound modality concerning with examination of the blood flow inside arteries and veins. First, discovered by Christian Doppler, 1853. I think every radiologist is experienced in ultrasound Doppler as a first modality in practice. First, we'll talk about groin flaps. Groin flaps is a flaps taken from the groin and implanted in any other place, actually like here in the photo, in the cheek and neck. The flap is excised with its vascular pedicle, and so the vascular surgeons and plastic surgeons will need mapping for the vascular pedicle for the flap excision to be excised in properly and be implanted afterwards in rightwards. First, Doppler assessment vascular pedicle of the groin flaps are commonly used reconstructive surgery for coverage of extremity defects. Their vascular supply is derived from superficial circumflex iliac artery and superficial inferior epigastric artery. Handheld Doppler ultrasound is used primarily to identify the perforators, to assess pedicle patency, and to estimate flow and caliper. Here is the schematic for the probe which is used for the mapping, which is a superficial probe in a frequency from 7 to 11 megahertz. I'll take the scanning view and spectral flow of the vessels. Anatomy of the superficial circumflex iliac artery and its branches. It originates from the femoral artery 1 to 2 centimeters below the inguinal ligament. Branches, superficial branch courses superficially along the inguinal ligament towards the anterior superior iliac spine. Deep branch travels deeper towards the sartorius muscle. Caliper, superficial branch 1 to 1.5 millimeters, deep branch 1.5 to 2.5 millimeters. Tubular waveforms actually have high resistance arterial waveform with a sharp systolic and peak minimal diastolic flow. Here's the diagrammatic for the flap taken in this ellipse, and this is the course of the vessel, and this is the waveform of the vessel. Ultrasound imaging, the superficial circumflex iliac perforator. Superficial inferior epigastric artery actually is not very dominant. It originates from the femoral artery, courses superficial to the fascia, and ascends medial towards umbilicus. Caliber from 1.5 to 2 millimeters, highly variable, often hypoplastic or sometimes agenetic or absent. Tubular finding, low to moderate resistance, biphasic or triphasic flow. This is the mapping of the branch. Superficial branch or deep branch of superficial circumflex iliac artery. Superficial circumflex iliac artery, again, it's a dominant pedicle in groin flap. Doppler mapping tips probe placed along the inguinal ligament towards the anterior superior iliac spine and identified dominant branch, superficial and deep branch. The waveforms, as we said before, high resistant and triphasic. And lastly, this is a illustrative image of the flaps. and the venous mapping of it. Combine Doppler findings with clinical data. Clinical evidence helps us choose between superficial circumference and superficial inferior epigastric artery, a pedicle vascular flap, and this is a table for comparison. Origin from the femoral artery, all originated from the femoral artery, with caliber ranging from 1 to 2 millimeters. Doppler waveform, high resistive for the superficial and deep branch of the superficial circumference iliac artery. The superficial epigastric shows low resistance. Second graph will talk about the thoracodorsal perforate artery perforators and the lateral intercostal artery perforators. Unlike here we saw in this the previous picture, Doppler examination of the vascular pedicle, thoracodorsal artery, mainly it used for the reconstructive surgery of the breast surgery. Branches from the thoracodorsal artery, branches from the subscapular artery, from axillary artery, and bifurcates into descending vertical and transverse horizontal branches. Lateral intercostal artery originates from the posterior intercostal artery. This is the venous mapping. As you see, the thoracodorsal artery courses under the latissimus dorsi gives off 3 to 4 musculocutaneous perforators, open 5 millimeters or more, within about 8 centimeters distal to the axilla. Typical pedicle length from 12 to 14 centimeters, perforators 5 to 8 centimeter length. Lateral intercostal artery perforators emerge lateral chest wall 2.5 to 3.5 centimeter anterior to the latissimus dorsi, especially in 6 intercostal space. Multiple perforators usually present mean to 3 to 0.9 per side. Doppler examination. Doppler waveform variations, color Doppler and handheld Doppler. Color Doppler good for visualizing below 0.5 millimeter capillary. Handheld Doppler gives a positive predictive value about 95%, locates perforator within about 7 millimeters. Anatomical variations, direct cutaneous perforators and intercostal serratus connections. Doppler examination of the vascular pedicle, landmarks, thoracodorsal artery landmarks, about 8 centimeters below posterior axillary fold, 2 centimeters posterior to the latissimus dorsi border, 3 to 6 centimeters below scapular tip, 1 to 4 centimeters medial to the lateral muscle edge. Like cap landmarks uses 6 intercostal space, 2.5 to 3.5 centimeters anterior to the latissimus border. Mapping techniques. Patient lateral decubitus, arm abducted 90 degrees. Use handheld Doppler and color Doppler to thermography. Here's the vessel. There's the diagram about it, and the color Doppler study. Doppler examination of the vascular pedicle, thoracodorsal and lateral intercostal artery. Clinical evidence, high resistive arterial pattern with visible perforator sign. Pedicle variation include multiple perforators or septal direct perforators. Harvesters keep one strong perforator intact, dissect pedicle to sufficient length. This is dedicated for the surgeons. Presence of thoracodorsal nerve and muscle to be preserved. And lateral intercostal artery flaps are shorter and best for lateral breast defects. Outcomes, high flap survival and handheld color Doppler minimizes intraoperative surprises. The third and last flap we're dealing today is transverse cervical artery flap. Introduction anatomical overview. Overview transverse cervical arterial artery. Definition: it's a branch of the thyrocervical trunk supplying the trapezius and adjacent muscles. Origin arises from the thyrocervical trunk, which originates from the subclavian artery. Of course, it runs lateral across the base of the neck, passes deep to the omohyoid and sternomastoid muscle, courses posteriorly towards the trapezius. Branches: superficial branch often used in the flap, deep branch may anastomose with the dorsoscapular artery. Doppler examination: caliber of the vessel, diameter typical range from 1.5 to 3 millimeters in adult, sufficient for flap perfusion and macrovascular anastomosis. Variations: may arise directly from the subclavian artery, deep branch may substitute or be substituted by the dorsoscapular artery. Absence of one branch in rare cases, flap planning must consider this. Clinical significance: preoperative Doppler mapping essential to assess dominant vascular supply. Here is the diagram of the flap we're dealing with. This is the mapping diagram for it. This is the transverse cervical artery. Doppler ultrasound mapping for the transverse cervical artery. Patient supine with neck slightly extended and rotated away from the side being examined, so either right or left. Landmarks: posterior border of the sternomastoid muscle, supraclavicular fossa, and lateral border of the trapezius. Technique: use high-frequency linear probe from 8 to 15 megahertz. Identify the artery and its origin near the thyrocervical trunk. Track along the course towards the trapezius. Doppler waveform interactions. Characteristics of the transcervical dorsal artery. Waveforms of low resistive arterial waveform. Key features: rapid systolic upstole and persistent flow, forward flow in diastole. Interpretation: strong, consistent signal confirms vessel patency. Low resistant waveform confers perfusion suitably for flap use. Pitfalls: overlying muscle can attenuate the signal, vessel spasm, or sometimes small caliber may affect visualization. Doppler examination: this is the diaphragm, this is the transverse cervical artery, and this is the triangular area we are dealing with. And that's a model of the mapping technique we do for the clinician or the surgeon, either plastic or vascular surgeon. Doppler examination of the vascular pedicle, transverse cervical artery flap. Surgical mapping: as we said, preoperative mapping and flap design. Mapping strategy: mark the course of the transverse cervical artery with Doppler, mark zones reliable perfusion along the posterior angle, and flap design based on the reliable anatomy of superficial branch of transverse cervical artery. Doppler aids in planning skin battle and minimizing donor site morbidity. Conclusion: Doppler assessment enhances the flap reliability and surgical outcomes. Thank you.
Thank you, Dr. Mostafa. Questions? Any questions?